The number of college athletes dying by suicide doubled in the 20 years to 2022 to become the second most common cause of death among athletes after accidents, according to research published Thursday in the British Journal of Sports Medicine, amid mounting concern over the mental health and well-being of elite athletes and young adults. While rates of suicide have broadly increased in recent years, it has gone up by around a third between 2001 and 2021. The jump has been far greater among college athletes, sparking growing concern over the mental well-being of the group. The researchers said it is not entirely clear why, but noted a series of relevant factors that would affect mental health that are specific or amplified among college athletes. While athletes are generally thought of as one of the healthiest populations in our society, the researchers said, pressures of school, internal and external performance expectations, time demands, injury, athletic identity and physical fatigue can all contribute to issues like depression, mental health problems and suicide. There may also be additional stressors for college athletes like harassment and abuse within the sport, such as hazing, psychological, physical and sexual abuse and cyberbullying from the public, other athletes and coaches. The researchers noted social media and the recent emergence of name and likeness deals in the NCAA as factors that could compound these issues for some athletes and increase the pressures faced. Awareness and training among staff dealing with athletes could help address the growing issue, the researchers said, as could screening to identify at-risk athletes and providing access to health providers trained in sports psychology. The researchers said their findings potentially underestimate the incidence of suicide among college athletes. There is no mandatory reporting system for athlete deaths in the U.S., and this dearth of reliable information makes it hard to assess the impact of measures put in place to protect athletes, the researchers said. With no mandatory reporting, other pertinent information was also unavailable for them to consider in their research. Foremost was information on underlying mental health issues like anxiety and depression among the athletes, which impact incidence of suicide, as well as more detailed information on deaths by overdose, which could be deliberate or accidental. 700,000. That's how many people die worldwide by suicide each year, according to the World Health Organization, which notes that, for every suicide there are many more people who attempt suicide. The Centers for Disease Control and Prevention said suicide was responsible for more than 48,000 deaths in 2021, around 1 every 11 minutes, and ranks among the top 9 causes of death for people ages 10 to 64. It was the second leading cause of death for people ages 10 to 14 and 20 to 34.